COBRA continuation of benefits. COBRA is a federal law that guarantees a continuation of their group coverage if their employment is terminated for reasons other than gross misconduct. It stands for the Consolidated Omnibus Budget Reconciliation Act of 1985. Protects employees who are laid off, but not those who are fired for cause. The law does not protect those are covered by other hospital, surgical or medical coverage for individuals in a group plan. However, the law requires the employer to provide the employee with a written notification of the continuation privilege. Requires employers with 20 or more employees to continue group medical expense coverage for terminated workers for up to 18 months following termination. The law does not require the employer to pay the cost of the continued group coverage. After expiration of group benefits under COBRA, a fully insured group policy can be converted to an individual health insurance policy. The terminated employee can be required to pay the premium, which may be up to 102% of the premium that would otherwise be charged. The benefits under COBRA continuation coverage will end if the employer terminates all group health plans. The following events would qualify for extended medical expense coverage under COBRA for a terminated employee. Employment is terminated for other than gross misconduct. 18 months of continued coverage or up to 29 months if disabled. Employee's hours are reduced, resulting in termination from the plan. 18 months of continued coverage or up to 29 months if disabled. Employee dies. 36 months of continued coverage for dependents. Dependent child no longer qualifies as dependent child under the plan. 36 months of continued coverage. Employee becomes eligible for Medicare. 36 months of continued coverage. Employee divorces or legally separates. 36 months of continued coverage for former spouse. Common exclusions to continuation of group coverage includes dental, vision care, and other prescription drug benefits. Pregnancy Discrimination Act 17. The Pregnancy Discrimination Act of 1978 is an amendment to the Civil Rights Act of 1964 designed to prohibit sex discrimination on the basis of pregnancy. Requires employers to treat pregnancy in the same manner as a disability for any other medical reason. Requires group plans covering 15 or more people to treat pregnancy-related claims no differently than any other allowable medical expense. Group health insurance coverages. Health insurance group plans are predetermined by the employer in conjunction with the insurer's benefit schedules and coverage limits. Group health insurance contracts providing coverage for employees in more than one state are usually controlled by the laws of the state where the master contract is issued. Working people age 65 or over generally must be offered the same accident and health benefits offered to younger employees. Group basic medical expense. The three standard forms of basic medical expense insurance, hospital, surgical, and physician's expenses are available for group insurance. A group basic medical expense plan can combine two or more of these coverages, or it may consist of only one type of coverage, such as hospital expense-only group major medical plans. Like individual major medical plans, group major medical plans may be offered as a single, extensive plan, comprehensive major medical, or superimposed over a group basic plan, supplemental major medical. Participants are usually required to satisfy an initial deductible with comprehensive plans and either a corridor or an integrated deductible with supplemental plans. Benefits provided by group major medical plans are usually more extensive than those of individual plans. For most group health plans, the coverage begins on the policy's effective date. However, some plans may also impose a waiting period which gives an insurance company the right to delay coverage for a covered sickness for a specified number of days after the effective date of the policy. No health plan coverage will begin until the application is completed and approved, the policy is issued, and the initial premium is paid. Dental care and vision care. Dental care coverage is designed to cover the costs associated with normal dental maintenance as well as oral surgery, root canal therapy, and orthodontia. The coverage may be on a reasonable and customary charge basis or on a dollar per service schedule approach. Deductible and coinsurance features are typical as are maximum yearly benefit amounts. Vision care coverage usually pays for reasonable and customary charges incurred during eye exams by ophthalmologists and optometrists. A common exclusion with vision plans is LASIK surgery. 18 Cafeteria plans, Section 125 plan. Section 125 is part of the IRS code that allows employees to convert a taxable cash benefit, salary, into non-taxable benefits. Under a Section 125 program, you may choose to pay for qualified benefit premiums before any taxes are deducted from employee paychecks. An S-corporation owner with a greater than 2% share is ineligible to participate in a Section 125 plan. Cafeteria plans are benefit arrangements in which employees can pick and choose from a menu of benefits, thus tailoring their benefits package to their specific needs. Employees can select the benefits they value or need and forego those of lesser importance to them. The employer allocates a certain amount of money to each employee to buy the benefits he/she desires. If the cost of the benefits exceeds the allocation, the employee may contribute the balance. Without a Section 125 plan in place, an employee's payroll contribution would not be allowed to enhance. Church employee welfare plans are specifically exempt from regulation under ERISA wellness programs. Employers offer at least some wellness programs in an effort to promote employee health and productivity and reduce health-related costs. Wellness programs focus on drug abuse and stress. Can also be offered by insurance plans directly to their enrollees' group disability income plans. Group disability plans usually specify benefits in terms of a percentage of the individual's earnings. Most group disability plans require the employee to have a minimum period of service, such as 30 to 90 days, before being eligible for coverage. A group disability income plan that pays tax-free benefits to covered employees is considered fully contributory. Group short-term disability plans are characterized by maximum benefit periods of rather short duration, such as 13 or 26 weeks. Group long-term disability plans provide for maximum benefit periods of more than 2 years, occasionally extending to the insured's retirement age. Group health plan termination. No employer or fiduciary managing a group life or health plan may willfully refuse to pay premiums in order to cause the cancellation or non-renewal of the plan. The employer or fiduciary must provide 45 days notice of termination of the plan to all those covered and receiving benefits. Any person violating this regulation shall be guilty of a Class H felony. Offsets for payments. Group disability benefits are generally coordinated with or decreased by disability income received from government plans, pensions or other forms of social insurance such as Social Security disability or workers' compensation. Individual disability income policies generally pay the monthly income benefit in addition to any income derived from other sources. 19 Group addend. Frequently offered in conjunction with group life insurance plans. May be provided as a separate policy, such as employee pay-all plans, which are called voluntary group addend. May be provided for both occupational and non-occupationally losses or for non-occupationally losses only. Normally, does not include a conversion privilege. Blanket health plans. Blanket health insurance is issued to cover a group who may be exposed to the same risks, but the composition of the group, the individuals within the group, are constantly changing. A blanket health plan may be issued to an airline or a bus company to cover its passengers, or to a school to cover its students. No certificates of coverage are issued in a blanket health plan, as compared to group insurance. Franchise health plans, wholesale plans, provide health insurance coverage to members of an association or professional society. Individual policies are issued to individual members and the association or society simply serves as the sponsor for the plan. Premium rates are usually discounted for franchise plans. Credit accident and health plans. Credit accident and health plans are designed to help the insured pay off a loan in the event she is disabled due to an accident or sickness. If the insured becomes disabled, the policy provides for monthly benefit payments equal to the monthly loan payments due health savings accounts, HSAs. An HSA is a tax-favored vehicle for accumulating funds to cover medical expenses. Individuals under age 65 are eligible to establish and contribute to HSAs if they have a qualified high-deductible health plan. Annual contributions of up to 100% of an individual's health plan deductible can be made to an HSA. Individuals who are 55 to 65 years old can make an additional catch-up contribution. Earnings in HSAs grow tax-free, and account beneficiaries can make tax-free withdrawals to cover current and future qualified healthcare costs. Qualified healthcare expenses include amounts paid for O doctor's fees o prescription and non-prescription medicines o necessary hospital services not paid for by insurance o retiree health insurance premiums o Medicare expenses but no Medigap o qualified long-term care services o COBRA coverage 20 non-occupational health plans. A policy that does not cover injuries sustained while at work, because those injuries are covered by workers' compensation. Tax treatment of group health plans. Employers are entitled to take a tax deduction for premium contributions they make to a group health plan, as long as the contributions represent an ordinary and necessary business expense. As a general rule, individual premium contributions to a group health plan are not tax deductible. Individual participants do not include employer contributions made on their behalf as part of their taxable income. Any benefits an individual receives under a medical expense plan are not considered taxable income, because they are provided to cover losses the individual incurred. Disability benefit payments that are attributed to employee contributions are not taxable, but benefit payments that are attributed to employer contributions are taxable. Sole proprietors are permitted tax deductions for health costs paid from their earnings in the amount of 100% of costs. Federal income taxes will not likely be applied to death benefits paid to the named beneficiary of an insured under a health insurance policy. However, the proceeds may still be included as part of the insured's taxable estate for estate tax purposes. Accidental death and dismemberment insurance pays benefits in the event of a fatal accident or if dismemberment results from an accidental injury. Primary form of pure accident coverage provides a stated lump sum benefit in the event of accidental death or in the event of loss of body members due to accidental injury. Principal sumo the principal sumundi relevant policy is the amount payable is a death benefit. Atis the amount of insurance purchased $10,000, $25,000, $50,000, $100,000, or more. The principal sum represents the maximum amount the policy will pay. Capital sumo another form of payment payable under an add-on policy is the amount payable for the accidental loss of sight or accidental dismemberment. It is a specified amount, usually expressed as a percentage of the principal sum, which varies according to the severity of the injury. For example, the benefit for the loss of one foot or one hand is typically of the principal sum. The benefit for the loss of one arm or one leg is usually 2/3 of the principal sum. The most extreme losses, such as both feet or sight in both eyes, generally qualify for payment of the full benefit, which is 100% of the principal sum. Policies that base their benefit payments on accidental means require that both the cause and the result of an accident must be unintentional. Add-on can be purchased by individuals as a single policy or as part of an individual disability income policy. Add-on provide benefits only in the event of death or dismemberment due to an accident. Limited risk policies set forth specific risk and provide benefits to cover death or dismemberment due to that risk. Special risk policies covers unusual hazards normally not covered under ordinary accident and health insurance. 21 Health insurance providers. Commercial insurance providers' health insurance may be written by a number of commercial insurers. The list includes life insurance companies, casualty insurance companies, and monoline companies which specialize in one or more types of medical expense and disability income insurance. Commercial insurance companies function on the reimbursement approach. The right of assignment built into most commercial health policies lets policy owners assign benefit payments from the insurer directly to the healthcare provider, thus relieving the policy owner of first having to pay the medical care provider. Service providers offer benefits to subscribers in return for the payment of a premium. Benefits are in the form of services provided by hospitals and physicians in the plan. Blue Cross and Blue Shield. Blue Cross and Blue Shield are the dominant health insurers of the United States. The nation's Blue Cross and Blue Shield plans are loosely affiliated through the National Blue Cross and Blue Shield Association but are independently managed. The Blues provide the majority of their benefits on a service basis rather than on a reimbursement basis. This means that the insurer pays the provider directly for the medical treatment given to the subscriber, instead of reimbursing the insured. As participating providers, the doctors and hospitals contractually agree to specific costs for the medical services provided to subscribers. Members of Blue Cross and Blue Shield are known as subscribers. Blue Cross and Blue Shield plans are called prepaid plans because the subscribers pay a set fee, usually each month, for medical services covered under the plan. Most Blue Cross and Blue Shield organizations operate as non-profits. Health maintenance organizations. A health maintenance organization, or HMO, is another type of organization offering comprehensive prepaid healthcare services to its subscribing members. HMOs are distinguished by the fact that they not only finance healthcare services for their subscribers on a prepayment basis, but they also organize and deliver these health services at its own local healthcare facilities. Subscribers pay a fixed periodic fee to the HMO as opposed to paying for services only when needed, and are provided with a broad range of health services, from routine doctor visits to emergency and hospital care. Healthcare services are normally rendered only by physicians and hospitals providers who participate in the HMO. The payment given to a physician for each member of an HMO assigned to them is called capitation. When the HMO is represented by a group of physicians who are salaried employees and work out of the HMO's facility, this is known as a closed panel, sometimes called a staff model HMO. 22. For non-emergency situations in a closed network plan, a subscriber may be required to pay up to 100% of the billed amount if a health provider is chosen outside of the network. HMOs function on an individual or independent practice association (IPA) basis, which is characterized by a network of physicians who work out of their own facilities and participate in the HMO on a part-time basis. This is also known as an open panel. HMOs are known for stressing preventive care. Health maintenance organizations may be self-contained and self-funded based on dues or fees from their subscribers. They may also contract for excess insurance or administrative services provided by insurance companies. In fact, some HMOs are sponsored by insurance companies. Employers with 25 or more employees to offer enrollment in an HMO if they provide healthcare benefits for their workers. Hospital care under a typical HMO plan includes services such as hospitalization, in-hospital lab work and x-rays, inpatient laboratory services, and inpatient mental health care. HMOs often require subscribers to select a primary care physician, which is a doctor who provides all care for a particular member and controls all referrals for specialized care, and in some cases, hospital care. If a need for emergency health services arises for an enrollee of a health maintenance organization (HMO) using a gatekeeper system, the enrollee should proceed directly to the nearest emergency room. With HMO prescription drug plans, drugs are usually dispensed through participating pharmacies. An in-house pharmacy is typically available to enrollees in a staff model preferred provider organizations. Another type of health insurance provider is the Preferred Provider Organization, or PO. A preferred provider organization is a collection of healthcare providers such as physicians, hospitals, and clinics who offer their services to certain groups at pre-arranged discount prices. In return, the group refers its members to the preferred providers for healthcare services. Unlike HMOs, preferred provider organizations usually operate on a fee-for-service rendered basis, not on a prepaid basis. Members of the PO select from among the preferred providers for needed services. In contrast to HMOs, POs provide a wider choice of physicians. PO healthcare providers are normally in private practice. They have agreed to offer their services to the group and its members at fees that are typically less than what they normally charge. In return, the group refers its members to the PO, and the providers broaden their patient service base. If service is obtained outside the PO, benefits are reduced and costs increase. Groups that contract with POs are often employers, insurance companies, or other health insurance benefit providers. While these groups do not mandate that individual members must use the PO, a reduced benefit is typical if they do not. If a patient with a preferred provider organization (PO) chooses to use a non-PO, the patient usually can expect to have higher out-of-pocket expenses. Ambulatory care is a personal healthcare consultation, treatment, or intervention using advanced medical technology or procedures delivered on an outpatient basis. Designed to handle 23. Outpatient surgery, routine physicals, immunizations. Government insurance programs. Government provides insurance for many reasons. The primary reasons include to meet social needs, to make insurance available for certain groups, to encourage economic development. Medicare, the federally administered Medicare program, took effect in 1966. Its purpose is to provide hospital and medical expense insurance protection to those aged 65 and older. It also provides insurance protection to any individual who suffers from chronic kidney disease or to those who have been receiving Social Security disability benefits for at least 24 months. Medicare Part A hospital insurance covers inpatient care in hospitals and skilled nursing facilities, and it covers care provided in a hospice and some care provided at home. Part A covers drugs administered as part of inpatient treatment. Social Security Administration enrollment for the Medicare program and provides information about Medicare to the public. All parts of the Medicare program, except for public information and enrollment, are administered by the Centers for Medicare and Medicaid Services. The day the insured enters a hospital is the first day of a Medicare Part A benefit period. Skilled nursing facility expenses are sometimes covered by Medicare Part A, but only if the insured was hospitalized shortly before entering the facility. Medicare Part A will cover a maximum of 100 days per benefit period in a skilled nursing facility. Days 1-20 will pay 100%. Days 21-100 will pay a flat dollar amount per day. The lifetime maximum for inpatient psychiatric care under Part A Medicare is 190 days. The primary source of financing for Part A is federal payroll and self-employment taxes. Physicians who agree to accept assignment on all Medicare claims are called participating providers. Dental care is not covered under Medicare. Medicare Part B medical insurance provides medical insurance for required doctor's services, outpatient services and medical supplies, and many services not covered by Part A. The difference between the physician's actual charges and Medicare's approved amount is called excess charge. Falling below the federal poverty level is not a qualifying event for Medicare. Open enrollment period for Medicare Part B is January 1 through March 31. When becoming eligible for Medicare, an individual can enroll in the Part C Medicare Advantage plan. Medicare Part B is funded by general tax revenue and user premiums. Medicare Part A covers inpatient hospital stay. To become eligible for Part D, prescription drug coverage, one must have Medicare coverage 24 Social Security disability income. Social Security provides services other than survivorship and retirement benefits. In addition to Medicare, the federal government also provides disability-related benefits through the Social Security OASD program. To be eligible for Social Security disability benefits, you need to be fully insured, in which you need at least 1/4 of coverage for each calendar year after turning 21 years old. The minimum number of credits needed is 6. To be fully insured on a permanent basis, 40 quarter credits are required. At this point you are fully insured for Social Security disability benefits whether you continue to work or not. The maximum Social Security disability benefit an insured may receive is equal to 100% of the insured's primary insurance amount (PIA). Disability income benefits are available to covered workers who qualify under Social Security requirements. One of the requirements is that the individual must be so mentally or physically disabled that he cannot perform any substantial gainful work. The impairment must be expected to last at least 12 months or result in an earlier death. A 5-month waiting period is required before an individual will qualify for benefits, during which time he/she must remain disabled. The worker's spouse and dependent children are entitled to an income benefit which is a percentage of the worker's primary insurance amount. Medicaid is Title 19 of the Social Security Act, added to the Social Security program in 1965. Its purpose is to provide matching federal funds to states for their medical public assistance plans to help needy persons, regardless of age. Medicaid benefits are generally payable to low-income individuals who are blind, disabled, or under 21 years of age. The benefits may be applied to Medicare deductibles and co-payment requirements. Medicaid is financed by both federal and state governments. Under Medicaid, financial need is an eligibility requirement for the payment of nursing home expenses. TRICARE is a federal government accident and health plan which provides accident and health coverage to military families. Federal Employees Health Benefits Program. The Federal Employees Health Benefits (FEB) program is a system of managed competition through which employee health benefits are provided to civilian government employees and annuitants of the United States government. There are two types of plans that participate in the FEB program: fee-for-service plans and health maintenance organizations, prepaid. 25 state workers' compensation programs. Workers' compensation benefits generally compensate employees for lost wages and medical expenses due to occupational accidents. All states have workers' compensation laws, which were enacted to provide mandatory benefits to employees for work-related injuries, illness, or death. Employers are responsible for providing workers' compensation benefits to their employees and do so by purchasing coverage through state programs, private insurers, or by self-insuring. There is no time limit on how long workers' compensation medical expense benefits continue for disabled workers. The benefits arising from a workers' compensation claim could be inadequate to replace the loss of income. Under medical expense insurance policies, losses that are covered by workers' compensation are generally excluded from coverage. Alternative methods of providing health insurance: self-insurance. Many self-insured plans are administered by insurance companies or other organizations that are paid a fee for handling the paperwork and processing the claims. When an outside organization provides these functions, it is called an administrative services only (ASO) or third-party administrator (PA) arrangement. To bolster a self-insured plan, some groups adopt a minimum premium plan (MPP). These plans are designed to insure against a certain level of large, unpredictable losses, above and beyond the self-insured level. As the name implies, MPPs are available for a fraction of the insurer's normal premium. Multiple employer trusts. A method of marketing group benefits to employers who have a small number of employees is the multiple employer trust (MET). They are usually in the same industry group. METs can provide a single type of insurance, for example, health insurance, or a wide range of coverages, e.g., life, medical expense, and disability income insurance. An employer who wants to get coverage for employees from a MET must first become a member of the trust by subscribing to it. A MET may either provide benefits on a self-funded basis or fund benefits with a contract purchased from an insurance company. In the latter case, the trust, rather than the subscribing employers, is the master insurance contract holder. Participants are issued a joinder agreement document which an individual is admitted as a member and bound to the terms of membership. The employer's premium payments are directed into a trust from which the plan's benefits and claims are paid. These trusts are also called 501(c)(9) trusts after the relevant section of the Internal Revenue Code. Self-insured plans are common to multiple employer trusts (MATs) or multiple employer welfare arrangements (MUAs). They are also common in cases where the insured group is small, with relatively healthy members and few claims. Self-funded plans commonly use the services of an insurance company to act as a third-party administrator of the plan. Insurers may provide such services without responsibility for claims payment under an administrative services only (ASO) contract. 26 Multiple Employer Welfare Arrangements. A multiple employer welfare arrangement (MUA) is a type of MET. It consists of small employers who have joined to provide health benefits for their employees, often on a self-insured basis. They are tax-exempt entities. Employees covered by a MUA are required by law to have an employment-related Common Bond 27 disability income insurance. Purpose of disability income insurance. The insuring agreement of a disability income is designed to provide an individual with a specified income benefit in the event of a disabling accident or accident and sickness combined. The financial impact of total disability may be worse than the financial impact of death. Disability income policies are available as individual plans and group plans. They also serve a very important function for businesses and business owners. The most common type of individual disability income policy is a guaranteed renewable policy, which typically adjusts the premium on an annual basis and provide benefits for non-occupational illnesses and injuries. Disability income benefits. The insured's income limits the amount of the monthly benefit that an insured may select in a disability income policy. The benefits paid under a disability income policy are in the form of monthly income payments. The highest premium under the disability income policy is a 14-day waiting period with a 10-year benefit period. Insurers typically place a ceiling on the amount of disability income protection they will issue on any one applicant, defined in terms of the insured's earnings. Insurers use two methods to determine the amount of benefits payable under their disability income policies: percent of earnings approach and the flat amount method. The first method is called the percent of earnings approach, which determines the benefit using a percentage of the insured's pre-disability earnings and considers other sources of disability income. The second method used to establish disability benefits is the flat amount method. Under this approach, the policy specifies a flat income benefit amount that will be paid if the insured becomes totally disabled. Normally, this amount is payable regardless of any other income benefits the insured may receive. In the event the insured dies because of the disability, any earned but unpaid benefits will be paid to the insured's estate. Group long-term disability benefit amounts are typically limited to 60% of a participant's income. Disability defined. With one exception, partial disability, an insured must be totally disabled before benefits under a disability income policy are payable. What constitutes total disability varies from policy to policy. The insured must meet the definitions set forth in her policy. In disability income insurance, the definition of total disability often considers the insured's education, training, and experience. There are two definitions: any occupation or own occupation. 28 Any occupation. The any occupation, or also known as combination definitions, of total disability requires the insured to be unable to perform any occupation for which he is reasonably suited by reason of education, training, or experience to qualify for disability income benefits. Own occupation. The own occupation definition of total disability requires that the insured be unable to perform the insured's current occupation because of an accident or sickness. From a policy owner's point of view, an own occupation disability income policy is more advantageous. It is more expensive and difficult to qualify for presumptive disability. This provision specifies certain conditions that automatically qualify the insured for the full benefit, because the severity of the conditions presumes the insured is totally disabled even if he can work. Presumptive disabilities include blindness, deafness, loss of speech, and loss of two or more limbs. In this case, it is presumed you are disabled. A presumptive disability provision typically waives the usual requirements for total disability benefits. Partial disability. The inability of the insured to perform one or more important duties of the job, or the inability to work at that job on a full-time basis, either of which results in a decrease in income. Normally, partial disability benefits are payable only if the policy owner has first been totally disabled. Permanent partial disability would be less than total impairment and equal to permanent impairment. This benefit is intended to encourage disabled insureds to get back to work, even on a part-time basis, without fear that they will lose all their disability income benefits. The amount of benefit payable when a policy covers partial disabilities depends on whether the policy stipulates a flat amount or a residual amount. Flat amount benefit. A flat amount benefit is a set amount stated in the policy. This amount is usually 50% of the full disability benefit. For example, let's assume Helen, who has a disability income policy with an own occupation definition, is severely injured after falling down a flight of stairs. She is unable to work for 4 months, during which time her disability income policy pays a full benefit. After 4 months she can return to work, but only on a part-time basis, earning substantially less than she did before her injury. If her policy did not contain a partial disability provision, her benefits would cease entirely because she no longer meets the definition of totally disabled. However, if her policy provides for partial disability benefits to be paid as a flat amount, she will be able to work on a part-time basis and continue to receive half of her disability benefits. 29 Residual amount benefit. Normally used after a full disability payment have been paid and the insured is back to work, however with a reduced workload. A residual amount benefit is based on the proportion of income lost due to the partial disability, considering the fact that the insured is able to work and earn some income. The benefit is usually determined by multiplying the percentage of lost income by the stated monthly benefit for total disability. For example, let's say your job was to wash 10 cars a day. You broke your arm, were still able to work, but could only wash 6 cars a day because of the residual impact of the broken arm. If the insured suffered a 40% loss of income because of the partial disability, the residual benefit payable would be 40% of the benefit that the policy would provide for total disability. A residual disability benefit is usually a percentage of the total disability benefit for when the insured is working, but unable to perform some of the duties of his/her occupation. Rehabilitation benefit. An insured may not be able to return normal occupation because of a disability, but still be able to work at some kind of job. The rehabilitation benefit facilitates vocational training to prepare insureds for a new occupation. Under the rehabilitation benefit in a disability income policy, the insurer will pay the approved cost of a rehabilitation program to help a disabled return to work cause of disability. Policies that use the accidental means provision require that the cause of the injury must have been unexpected, and accidental policies that use the accidental bodily injury provision or results provision require that the result of the injury has to be unexpected and accidental. For example, Jim took an intentional dive off a high, rocky ledge into a lake. He struck his head on some rocks and ended up partially paralyzed. If his policy had an accidental means provision, the benefits would probably not be payable because the cause of his injury, the dive, was intentional. However, if his policy had an accidental bodily injury or results provision, benefits would be payable because the result of the accident, his injury, was unintentional and accidental. Today, most disability income policies use the accidental bodily injury or results provision, which is far less restrictive than the accidental means provision. Disability income policy provisions. Probationary period. The probationary period specified in a disability insurance policy is the period of time that must elapse following the effective date of the policy before benefits are payable. 30. It is a one-time only period that begins on the policy's effective date and ends 15 or 30 days after the policy has been in force. Purpose of the probationary period is to exclude pre-existing sicknesses from coverage and provide a guidepost in borderline cases when there is a question as to whether an insured became ill before or after the effective date of the policy. Helps protect the insurer against adverse selection because those who know they are ill are more likely to try to obtain insurance coverage. Probationary period does not apply to accidents because you cannot anticipate an accident elimination period. The elimination period is the time immediately following the start of a disability when benefits are not payable. Elimination periods eliminate claims for short-term disabilities. The longer the elimination period, the lower the premium for comparable disability benefits. The elimination period is sometimes called the waiting period benefit period. The benefit period is the maximum length of time that disability income benefits will be paid to the disabled insured. The longer the benefit period, the higher the cost of the policy. Individual short-term policies provide benefits for 6 months to 2 years. Individual long-term policies are characterized by benefit periods of more than 2 years, such as 5, 10, or 20 delayed disability provision. In some cases, total disability does not occur immediately after an accident but develops some days or weeks later. Most policies allow a certain amount of time during which total disability may result from an accident and the insured will still be eligible for benefits. The amount of time allowed for a delayed disability may be 30, 60, or 90 days, etc. Recurrent disability provision. It is not unusual for a person who experienced a total disability to recover and then, weeks or months later, undergo a recurrence of the same disability. Most policies provide for recurrent disabilities by specifying a period of time during which the recurrence of a disability is considered a continuation of the prior disability. The insurer will then pay benefits without a new elimination period. If the recurrence takes place after that period, it is considered a new disability and will be subject to a new elimination period before benefits are again payable. For example, say you were recovering from a serious illness and missed 2 months of work. Then you went back to work and 2 weeks later the disability came back or recurred and you were forced to miss more work while you recovered again. 31. Change of occupation provision. Under the change of occupation provision, if an individual covered under a disability income policy is injured while engaged in an occupation that is more hazardous than the occupation stated in the policy, the result will be the benefit level is reduced. If the insured is engaged in a less hazardous occupation than that was originally stated in the policy, the benefits will likely be increased non-disabling injury. Frequently, a person covered by a disability income policy will suffer an injury that does not qualify for income benefits. Many such policies include a provision for a medical expense benefit that pays the actual cost of medical treatment for non-disabling injuries that result from an accident or sickness. Elective indemnity. Some short-term disability income policies provide for an optional lump sum payment for certain named injuries. The insured may sometimes select this elective indemnity option when applying for the policy coverage after age 65. Disability income policies typically require the insured to be actively working for the stated number of hours per week if coverage extends past age 65. Disability income policy riders. Waiver of premium rider. A waiver of premium rider generally is included with guaranteed renewable and non-cancelable individual disability income policies. It exempts a policy owner from paying the policy's premiums during periods of total disability. To qualify for the exemption, the insured must experience total disability for more than a specified period, commonly 3 or 6 months. The waiver of premium generally does not extend past the insured's age 60 or 65. Premiums are waived beginning at the date of disability. Disability benefits in a life insurance contract. Many insurers offer a waiver of premium rider that also includes a disability income benefit. Most riders provide a benefit of 1% of the face amount of the policy, which is payable if the insured is totally disabled. 32 Social Security Rider. The Social Security Rider provides for the payment of additional income when the insured is eligible for social insurance benefits, but those benefits have not yet begun, have been denied, or have begun in an amount less than the benefit amount of the rider cost of living adjustment (COLA) rider. The cost of living adjustment (COLA) rider provides for indexing the monthly or weekly benefit payable under a disability policy to changes in the Consumer Price Index (CPI). Typically, the benefit amount is adjusted on each disability anniversary date to reflect changes in the CPI. Guaranteed Insurability Rider. This option guarantees the insured the right to purchase additional amounts of disability income coverage at predetermined times in the future without evidence of insurability. Exclusion Rider. An exclusion rider on a disability income policy means that a specified disease or body part is not afforded coverage. 33 Medical expense insurance. Medical expense insurance provides financial protection against the cost of medical care for accidents and illness. Loss due to accident and illness are the perils covered by medical expense insurance. Coverage may be provided for hospital care, physician services, surgical expenses, diagnostic and laboratory services, drugs, nursing, and other medically necessary procedures. The broadness of the specific types of services and treatment are dependent upon the medical expense policy written. Medical expense insurance typically excludes coverage for care provided in a government facility. Individual medical expense insurance typically is written for a term of 1 year,